The discussion of global healthcare reform could fill many books. In this short piece, I will try to highlight some of the major forces shaping healthcare reform around the globe. In virtually every corner of the globe, healthcare reform is going on. In low-income countries, the struggle is to find the resources to provide even basic health care to their citizens. In higher income countries, the problem often is one of financing the health care that people have gotten used to. In the emerging markets, both forces are at work. Income plays a role. In study after study, it has been shown that as income rises, the demand for health care rises even faster. So low-income countries who have struggled with the ability to even provide basic health care services are finding themselves, as their income grows, facing even bigger challenges. These are the so-called emerging markets. One of the characteristics of many of the emerging markets is that there has been a growth in the so-called middle class. And this middle class demands much better healthcare services than had previously been provided. The wealthier countries, by contrast, have grown used to having very good healthcare services. But they're facing a different challenge. Many members of their population are now in the retirement class, and so that class has grown while the working class has been shrinking. So the resources available to finance healthcare are becoming more scarce. On the other hand, the individuals who have been used to having very good healthcare are not willing to accept a lower standard. So these countries are facing a financial issue with respect to healthcare that is somewhat different than that from the emerging markets. In the United States, for example, the healthcare sector is the fastest growing sector and will soon top 20% of our total output. This is not sustainable. Advancements in healthcare technologies have also played a role. A century ago, there were very few technologies that could be used to treat disease. Even simple antibiotics were not available. So a lot of people died of infections at a very early age. Vaccines were also not available. Many children died of communicable diseases. Over time, we have been able to develop new vaccines and new antibiotics, and so we were able to treat many of the conditions that used to cause death in our ancestors. So we are now living much longer. But with living longer, we also find ourselves being exposed to more diseases. So that it's ironically the case that we are both healthier and sicker. We live longer, but as we live longer, we are exposed to more and more diseases. Cost of care plays a big role. The new technologies do not come cheap. Yes, there are some antibiotics and vaccines which are rather inexpensive, but there are many other technologies such as transplantation, some of the advanced surgeries, and treatments for cancer which come at a very, very high price tag. Even in wealthy countries, there are questions about whether or not these treatments are cost effective. But once the treatments are there, it is very difficult to withhold them from people who demand these treatments. Hence, the new treatments that are available and the new technologies that are available often contribute substantially to the increase in the cost of health care. In Europe, many countries have faced this same problem, but do so by being willing to ration care through some form of cost effectiveness analysis. But in other countries, such as the US, it has been much harder to ration this care. The population is just not prepared for it. And as a result, the cost of health care continues to go up as we provide more and more technologies that can treat conditions which we could not treat in the past. As the demographics move to a larger retired population and a smaller working class, the questions about what types of social programs, including health care, we can afford will be growing and growing in importance. As low-income countries deal with a rise in income, they will also face a demand for more consumption of things such as better environment, better education, and importantly, very much better health care. Where this plays out is going to vary from country to country. In more autocratic countries, the government will be able to dictate which of these areas gets the most attention. But in more democratic countries, The population itself will have to make serious choices. Higher income countries are facing a different problem, that as the new technologies make it possible to do more and more things, they're going to find it much more difficult to finance all the things that are possible to have done. There will have to be some very serious discussions about what technologies we are going to adopt and who is going to receive those. The specific reforms will vary from country to country. But as countries become wealthier, the main issue will shift from providing basic healthcare services to trying to limit healthcare services to keep it within the budget.